Hey everyone, welcome back to Discussions with Dr. G. I'm Dr. G, and yes, I'm still surviving thanks to caffeine and an unending stack of nursing textbooks. Today we're tackling the big, beefy topic of nursing advocacy in the community, which, if you ask me, is kind of like being a professional troublemaker, but in the best way. So let's start at the ground floor. What exactly is nursing advocacy? The ANA, American Nurses Association, basically the wise grandparents of our profession, defines nursing as protection, promotion, prevention, relief from suffering, and crucially, advocacy. And that's advocacy for individuals, families, communities, whole populations. So it's not just about one-on-one hand-holding at the bedside. It's about thinking big picture. Advocacy is all about safeguarding clients' rights. Stuff like self-determination. That means people make their own choices, even if you're like, are you sure about that? It's supporting folks to make informed decisions, not pushing them, but making sure they've got the real information to decide. That's kind of huge, especially when we're working with people who might not have all the fancy medical lingo at their fingertips. Quick story. I was once helping a family during hospital discharge, and they were kind of getting steamrolled. The social worker was in a hurry, doctor wanted the bed, and the family just looked lost. I cracked a joke about, would you like fries with that discharge plan? And then gave the mom that classic mom glare, and all of a sudden, everyone shut up and let her talk. Sometimes a little humor and a dash of attitude is the best advocacy tool in your kit. Trust me, nurses are way scarier than doctors when we want to be. So let's move from theory to practice, because advocacy isn't just a happy word for our nursing philosophy essays. There are all sorts of ways it shows up on the ground. First, you've got advocating for your client or their family. A lot of that is education, helping them understand their options, risks, what level 2 bed really means, and how to say, nah, I don't want that test. You're upholding what they call the 6 client rights: self-determination, confidentiality, access to care, choice, information, and the ability to raise concerns or complaints. It's a mouthful, I know, but this is the bread and butter. Then there's community advocacy. Think beyond the hospital. In a school, a workplace, sometimes even correctional settings. It's about raising awareness, maybe about mental health resources, nutrition, or making sure everyone's got access to basic health care. Supporting education, safety, and equity. That's how you build a healthy community. Workplace advocacy? Oof, that one hits home. It's about making sure your unit is staffed well enough that you're not running on empty, that violence isn't just a part of the job. And yes, during COVID, mouthing off relentlessly until we finally got proper PPE. I mean, who else here felt like they became a part-time union rep, full-time mask police for the past few years? Just me? All right then. And don't forget legislative or political advocacy. Nurses actually have a seat at the policy table through the ANA or even organizations like the AONL. That's how things like safe nurse-patient ratios or opioid response plans actually become reality. Advocacy at this level is pushing for changes that help patients and nurses far beyond our own shifts. Here's something I think about a lot. Advocacy in a crazy busy hospital unit is a bit like a fire drill, right? You're fighting for a patient to get pain meds, or to get a translator, or to keep grandma from being shuttled out of the ER too soon. But in a community clinic, in a neighborhood school, it's quieter. It's more about health education, screening, connecting people with services. Both are advocacy, just totally different flavors. And honestly, both matter a ton. Now let's talk about this how this actually happens. Nuts and bolts style, where ethics fits in, because without that, it's just do whatever you want and call it nursing, which please don't. The advocacy process is a lot like the nursing process. Have you noticed nurses love a good process? First, we assess, figure out what the client needs, what rights might be at risk, where the system could fail them. Then we collaborate, set those goals together, not just what we think is best. After that, you plan, coordinate, communicate, maybe call in some reinforcements, intervene, speak up, educate, escalate if you need to. Finally, evaluate. Did it actually work? Did the client get what they needed? Was care safer? Was a hazard prevented? It's just like nursing care planning, except you guessed it, you're advocating as you go. But advocacy can't just be Dr. G said so. It's rooted in core ethical principles: autonomy, beneficence, non-malfeasance, justice. The ANA Code of Ethics isn't a dusty binder. It's the reason we fight for the right thing, even when it ruffles feathers. The Public Health Code, too, reminds us about transparency, equity, participation. Let me give you a case to tie it together. Picture Jessica, a new RN in a community clinic. She sees patients struggling with managing their meds. One guy can't read labels. Another keeps missing his blood pressure pills. Jessica stops, assesses, figures out the barriers, and then works with her patients. Simple pill organizers, bigger print labels, connecting folks with pharmacists. She applies advocacy and the process and is careful about each person's autonomy and safety. She's not just doing her job, she's translating advocacy into real life. So, to wrap it up for today, nursing advocacy in the community is more than raising your voice. It's listening hard, acting with integrity, and being curious about the why behind every client need. Stick around. Next time we'll get even deeper into the nitty-gritty of community health. And if you see me in the break room with 3 coffees, just hand me a 4th. See you next episode.